Hi everyone, thank you for tuning in. I'm Nathan Rockstroh with the Power of the Patient Project, and today with me is Mrs. Terri Scholer, patient representative at St. Mary Medical Center. Thanks.
Yes.
Thanks for taking the time out of your day today.
Thank you.
I have a few questions if I may ask them to you today.
Absolutely.
Please explain to our audience your role as coordinator of the Patient and Family Advisory Council at St. Mary Medical Center in Langhorne, Pennsylvania.
So our Patient Family Advisory Council consists of previous patients, family members of patients, and community members. Currently, we have about 13 members on our council, and we meet every other month for 2 hours, actually. And our goal really is to bring the voice of the community and the patients to St. Mary's. We have senior leadership sit on the council as well. So we hear opportunities for us to make changes, hear what went well during a previous visit, and it allows us just to hear the voice of our community so we can keep in tune with them. And also they bring to us ideas and we share with them programs that we offer here at St. Mary's they may otherwise not know about.
Excellent. And how did the initiatives of your team at St. Mary directly affect the patients?
So we actually are very fortunate right now. As of January, the patient concierge program's been in place. The patient concierge program consists of 2 full-time colleagues and a part-time colleague, as well as myself. Our goal is to do welcome rounds. So we meet and greet every patient within their first 24 hours, 48 hours if it's a weekend, when they come to St. Mary's, and really allow them to understand our goals for them while they're here with us. Keep them informed of their plan of care, medications, and also we provide them with a folder that is for discharge planning. So they can keep all of their information in that folder, and on the back is a discharge checklist. We also follow up on discharge, and the discharge call is not clinical, but it's really geared towards their experience here, what went well, and again, are there any opportunities for us to make any necessary changes.
Now for these intake visits, the welcoming visits, does that mean that your staff comes in on the weekend to make sure that they
We do
greet them?
Saturday, yeah, not Sunday, but we do Monday through Saturday, business hours, so 8 to 5. And we saw over 7,000 patients since January of this year and contacted on discharge calls over 5,000 patients. So we're really touching a lot of our patients here at St. Mary's.
As an advocate of patient-centered care, what do you feel are some of the important things that patients should know to protect their rights as a patient in the hospital or when visiting their doctor's office?
So I think it's really important for patients to understand that they have the opportunity, and they should make sure that they have the opportunity to ask questions. So clarifying questions, I think it's essential if you have the ability to have someone with you, to have somebody, a friend or a loved one with you, to hear what the physician's saying, to hear the plan of care, to hear the discharge instructions. Oftentimes patients, when they're in the hospital, are preoccupied. They're worried about what's going on at home, or their children being cared for, their animals, or the bills being paid. So sometimes they're not really listening to what the plan is. So I think it's really important to have somebody with you.
That's a major point of our project as well. In the presentations that we do, we encourage people to bring an extra set of ears to make sure they hear the whole plan of care.
It's not always possible. So sometimes, and again, we know that physicians can be under time constraints, but if you can have a phone available, I think another challenge is we don't always know when the physician's coming. So sometimes you can't have a loved one just sitting here waiting for a physician to do rounds. But if you have the ability, with smartphones nowadays, calling a loved one and having them on the phone and just ask the doctor, let me just quick call my daughter, my mom, whoever it might be.
Excellent point. We also encourage patients to use voice recorders if possible,
Nice.
as long as they have consent. Why should patients be worried about or concerned about having someone advocating for them on the administrative side within a facility?
Well, I think sometimes patients can kind of get lost in the shuffle, and especially with our elderly patient population. One of the biggest challenges that I see is when patients come in and they're elderly, dementia, maybe a little forgetful, not including that daughter in the plan of care. So I think that if the advocate, the patient concierge, if there's a representative that can be there, they really need to be the go-between so that we can help coordinate that care and answer questions when they're there, when we're posed. I think it's important for patients to understand they have the ability to ask for an advocate if they can't use their nurse, or if the nurse is not available. They do have somebody there that can be the go-between. Physician, all disciplines actually, not just physicians, but all disciplines.
And in your opinion, what are some of the standard policies and procedures that all hospitals should have in place to guarantee that the rights of patients are protected at all times?
I think most hospitals have their patient rights posted. They're also in the patient handbook. I think it's important for patients to understand that our goal is really their safety while they're here. Medication administration certainly is a essential safety point. I think what I would like to see is the transition being from acute care, whether it's to skilled or rehab or to home, to have that handoff verbal, whether it be to the patient's primary care physician, just so that we're all on the same page. And I think the transition, sometimes things get lost in the shuffle. And again, patients go home, maybe they have questions once they get home. If their primary care physician or the home care nurse is clear and understands what happened while they were in the hospital and what's supposed to happen at home, it really makes for a smooth transition, and also it helps the patient stay out of the hospital and stay healthy.
Excellent points. Your facility here has achieved many accolades and recognitions for your patient-centered care. You've done an excellent job reaching out to the patients. What do you think has been so special about this facility and how it's approached that patient-centered care in particular?
I think it's truly the engagement of all the colleagues. Without a doubt, everybody comes to work, wanting to do the best for our patients. And I think it speaks volumes that our senior leadership has decided to put the concierge program into place. That being said, they're vested. They know that the patient experience really matters, and we want their patients and the community members to have a voice. We have a huge volunteer department here as well. The community is very involved.
Awesome. Thank you very much for your time today, Ms. Terri.
Thank you.
All right.